So, depression is not your fault. Hello, everyone, and welcome to my channel. My name is Better Ome, and in this channel, we'll be talking about all things physical and mental health. Today, we're going to be discussing the 5 differences between sadness and depression. I do have a little note here that I made for myself just so I am able to tell you guys a little bit more about the differences between sadness and depression. So we're gonna get right into it. According to World Health Organization, 1 in 7 10 to 19-year-olds suffer from depression, and 280 million people worldwide also suffer from depression. So even though this is really a common illness, many people still are not able to tell the differences between sadness and depression. So we're going to discuss 5 things today of how you can tell. So the number one thing we will talk about is the definition of these two concepts. 1, sadness is a natural temporal response to a specific situation that may have occurred in your life, while depression is really a mental disorder that is only diagnosed by a mental health clinician. So for example, sadness is when you feel upset, you feel down, maybe you have had a loss and you take a test and the test doesn't go as you have planned, therefore you feel sad. Now in that situation, if it is temporal and specific to you failing the test. On the other hand, depression though, there is no known cause. You all of a sudden you feel down, you feel hopeless, you feel worthless, and you're not able to pinpoint to a specific situation why you're feeling that way. Number 2 is the duration. So for sadness, it's really temporary. Like I said before, it can last for a couple of hours, a couple of days. And when somebody comes around, perhaps talks to you about how you're feeling, you are able to come out of that sad feeling. While depression really stays with you. It lasts for hours, days, months, even years at times without treatment. So, for example, if you lose a friend or you lose a job, you may feel sad about it, but after a little while, you may come out of it, especially if you have someone who is able to do something nice for you, or you find another job right away, you make a new friend, you come out of that sad feeling. However, depression really affects your well-being, whether you have a change in jobs, whether you even pass the next test. It doesn't matter what's going on around you or in your life, you still feel depressed. So depression in that way stays with you for a long time. Now, the number 3 thing is the cause of the feeling. So for sadness, the cause is really something specific. Like I said before, it's called, there is an identified situation that makes you feel that way. The former example I use is if you have a friend or a family member who moved away and you miss them, that way you feel sad. But depression has no known trigger. You were not able to identify specifically what's making you feel that way. So that's the number 3 difference, is the cause. Now the 4th difference between sadness and depression that we're going to talk about are the symptoms. So the symptoms of sadness can include maybe feeling down, upset, you're tearful, you have a heavy heart, some simple natural feelings like that you can feel. But for depression, there's a whole wide of symptoms that you can feel, including having fatigue, difficulty concentrating, perhaps changes in your sleep or appetite, feelings of worthlessness, no interest in doing your everyday activities, things you used to enjoy before, you no longer enjoy doing them. Some people may even have thoughts of suicide, thoughts to harm themselves or somebody else. So these are ranges of symptoms that you can have when you are depressed. And you can see that there's a whole lot more symptoms that you can experience with depression, more than the natural feeling of just feeling sad. And then the fifth thing that we're going to talk about, that's the difference between sadness and depression, is the way we manage them. So for sadness, there is really no way to manage sadness. Like I said, it's a natural feeling, so you can snap out of it at any time. If you feel sad right now and somebody comes, perhaps takes you out, takes you to dinner, cheers you up, you do feel better and you come out of that sad feeling. But the management of depression, it requires more. And oftentimes it requires you to meet with a mental health provider. So this is when you hear people talking about going for therapy, perhaps seeing a psychiatrist or a mental health provider or a counselor, somebody who will give them the treatments that they need, perhaps with some medications to be able to treat those depressive symptoms that you may have. So if you do look at yourself and you determine that, hey, this doesn't feel like the regular sadness, the natural feeling of sadness that I feel most of the time, it looks like I may be veering towards depression. It's the time to talk with your primary care provider. It's the time to talk with your mental health provider. Have them assess you more to determine if you have depression, which only a mental health provider can diagnose. If you're diagnosed with depression, that's when you will need the treatments that we talked about, which is either psychotherapy or medication. So to kind of cap this up, I wanted to point out the key differences on how you can remember the difference between sadness and depression. So I have a little thing that I wrote down. So sadness is like a rainy day. It might feel gray for a while, but the sun comes back up. So you feel sad right now, but in a little while, something happens to take you out of that sad feeling. However, depression is like a storm that doesn't go away for a long time. So you might need someone to help you clear the clouds. So those two things that I just read now are really the key differences between sadness and depression. And I hope that I have been able to discuss today the key differences between the two concepts to help you distinguish the difference between sadness and depression, so that moving forward you are able to determine what feelings you are having and find ways to seek help and to combat them. Thank you so much for listening to me. I hope this has been educative to you. Please, if you do enjoy this video, like and subscribe, and I will see you in the next video. Thank you. Take care. Bye-bye.